welcome.
Hi, thank you so much for seeing me today. My name is Avia Shadmi. I'm a doctor of physical therapy.
Nice to meet you.
Here is a copy of my resume
Thank you.
for you to look over.
Alright. So I have a few questions for you, just to get started. So can you just tell me a little bit about yourself?
Of course. So I graduated from Ithaca College in upstate New York with a doctorate in physical therapy. I've always been a very hardworking person, and I've maintained above a 3.5 GPA throughout my 6 years at college. I am also a very competitive person. I grew up playing competitive soccer since I was 4 years old, and being on teams throughout my entire life through college has definitely fostered a competitive person within me. I always try to strive to be the best, but I know that it's also very unrealistic to be the best at everything. I'm also a very passionate person. When I care for something deeply, I really work towards helping others with that problem. In my high school, I was the chair of my Relay for Life, which is a walkathon to raise money and advocacy for cancer. And my relay was rated top 3 for money raised per capita in the nation. So that was really amazing to be able to give back in that magnitude back to the community that I care so strongly for. I'm also a very confident person. Not in a cocky way, just very confident. I was raised with very strong morals and values, and because of that, I have a very strong head on my shoulders. I always make my own decisions, and I tend to be a leader in a group rather than a follower.
Awesome, thank you for all that. Can you tell me a little bit why you're interested in this position here at the Children's Medical Center specifically, and kind of what interests you the most about this position?
Of course. So one of the first things I noticed about your facility is that you guys were named one of the best children's hospitals in U.S. News and World Report, which really struck me as an amazing place, and that's definitely something I want to be a part of. It speaks volumes for the quality of care that you guys are providing for your patients. I've also worked with children my entire life, so I through babysitting jobs and summer jobs, and I know how to foster a very trusting, fun relationship with kids, and I know that this is the population I want to work with, and a facility as great as you guys have. What I love about children is that they always say exactly what's on their mind, regardless of if it's positive or negative, which is great for me as a therapist because I need to know what my patients are thinking, and it also adds some comedic value throughout my day. I also love how children have such an empathetic, compassionate persona to them, which I think a lot of adults even can learn from, so that's definitely who I would love to surround myself with every day.
Just finishing my notes. Alright, thank you so much. So now, can you share some of your strengths and your weaknesses, just in general?
Of course. So overall, I think my rapport building skills are phenomenal. I have the ability to connect with people on an emotional as well as business level, whether they be children or senior citizens. I love to talk to people. I love to get to know them. So I think that's really important for a physical therapist to be able to do, to connect with their patients. I'm also a very hard worker. I strive for greatness, and I always do the best I can. I believe that I am a very good communicator, which is also very important in physical therapy because we work with different professions. We work with speech pathologists, we work with occupational therapists, and it's very important to be able to communicate if we're sharing patients, as well as to delegate to other people within the physical therapy clinic what's going on, delegate tasks in a respectful way. So I think that's also something I excel at. As for weaknesses, I feel that I'm a perfectionist with a lot of things, so that seems to be able to take some time away from other things I could be doing because I'm trying to do all of my tasks to the best of my ability. But I've also learned that I need to control the controllables, and I am not able to be the best at everything, and so that's a weakness that I'm working on.
So now, can you tell me kind of where you see yourself in about 3 to 5 years? Because the job field is changing a little bit, and people are getting new jobs more than they used to in the past.
Right. So in 3 to 5 years, I see myself working in a children's hospital as a physical therapist. I hope to have my specialty in pediatrics as well as lymphedema, because the population I really want to work with are pediatric patients that have cancer, unfortunately. So I want to be a pediatric oncology physical therapist. So having my specialty in lymphedema, I feel, would be very beneficial with this population. The reason I want to work with this population is because that, again, is something I'm very passionate about, and I want to do the best to maintain and improve quality of life for kids facing this terrible disease. So I think this facility would really be a great fit for me.
Can you tell me about a time that was challenging when you're either working with a patient or someone on your staff or in a team that you were able to work through and kind of overcome?
That you mentioned that, yes, I can. One of my patients in a previous clinical affiliation that I had was a 12-year-old girl who had a terrible ACL injury. So she came into our clinic very nervous, as you can imagine. She wouldn't even talk to my CI, who was her physical therapist. She would give him one-word answers. We weren't getting any feedback as to what she was feeling, what she was thinking. But she was able to connect with me almost after a week, and she would talk to me and tell me how she was feeling. So we used that to our advantage because she was a 12-year-old girl and she felt comfortable with me. So in the beginning, she would be extremely guarded. We wouldn't be able to move her, stretch her, anything without her crying. We wouldn't be able to even talk about putting any electric stimulation on her to strengthen her quads. She would cry in hysterics when we tried. And I talked to her. I told her the importance of why we needed to do these interventions before her surgery, just strengthen her quads to get some range of motion. And finally, after talking to her and making her feel more comfortable, she let us move her without guarding, and she let us raise the stim up. So it was a battle, but she got where she needed to be. So that was very rewarding.
Sounds very rewarding. Are there any particular types of patients that you'd like to work with? You kind of touched on this a little bit, but...
So when I was doing some research on your facility, I looked up some of the children's stories, and I was really touched by a few of the stories about patients that had different tumors and different cancers. So I think I'm not limited to who I would work with. I would work with any type of disorder, congenital disorder, but I really feel most connected to the patients that have these cancerous diseases, because that's who I really feel passionate about helping. And it amazes me to see, even through all the hardships that they're facing, that these kids have such an amazing outlook on life. And that would definitely be a great thing to witness every day.
So my last question is, do you have any other questions for me that you would like me to answer?
Yeah, so I saw that you guys have some, within your facility, that you have some continuing education opportunities for nurses. Do you have the same opportunities for physical therapists as well?
Yes, we have, we give every physical therapist a few $100s every year to use towards continuing education.
That's amazing. Okay, good to know. Also, how closely do you work with other therapists, like the speech pathologists and the occupational therapists? Is there a lot of overlap with patients?
It really depends on the patient, but definitely with specific patients and various disorders or diagnoses, they'll get definitely a co-treatment with either OT, PT, speech path. So it really just kind of depends on the child's need, but we do work as a team with other healthcare providers.
Awesome. Good to know. Thank you.
You're welcome. It was great meeting you.
Thank you so much for seeing me today. It was nice meeting you.
Nice meeting you as well.